Anticoagulants. Published by WordPress.com. In orthopedic surgery, anticoagulants are often used to prevent venous thromboembolism, VTE, which includes deep vein thrombosis, DVT, and pulmonary embolism, PE. Here are the commonly used anticoagulants with their trade names. 1. Low molecular weight heparins, LMWHs. Enoxaparin, Clexane INJ, dalteparin, Fragmin, Tinzaparin, Inohep. 2. Direct oral anticoagulants, DOACs. Rivaroxaban, Xarelto-Tab, Apixaban, Eliquis, Adoxaban, Lixiana, Dabigatran, Pradoxa. 3. Fondaparinux, Factor XA inhibitor. Fondaparinux, Orixtra. 4. Unfractionated heparin, UFH. No specific trade name, commonly used as generic heparin. 5. Warfarin, vitamin K antagonist. Warfarin, Coumadin, Marivan. 6. Aspirin, antiplatelet agent, sometimes used in low-risk cases. Aspirin, Asposid, Cardia. The use and duration of anticoagulants in orthopedic surgery depend on the type of surgery, the patient's risk of venous thromboembolism, VTE, and other individual risk factors. 1. Total hip replacement, THR. Indication: high risk of VTE due to reduced mobility and extensive surgery. Duration: typically 10 to 14 days postoperatively. Extended up to 35 days in high-risk patients, e.g., obese, cancer, prior VTE. 2. Total knee replacement, TKR. Indication: moderate to high VTE risk due to immobility and surgery. Duration: 10 to 14 days, depending on mobility and risk factors. 3. Hip fracture surgery. Indication: very high risk of VTE due to immobility and fracture. Duration: 10 to 14 days minimum. Extended up to 35 days in high-risk patients. 4. Spinal surgery. Indication: VTE risk depends on the extent of surgery and immobility. Duration: 7 to 10 days, but may vary depending on patient-specific risk. 5. Lower limb trauma, e.g., fractures, immobilization with casts. Indication: risk of VTE increases due to immobility. Duration: usually 4 to 6 weeks or until full weight bearing is resumed. 6. Arthroscopy, low-risk procedure. Indication: anticoagulants are usually not needed unless the patient has high VTE risk, e.g., prior VTE, cancer, obesity. Duration: single dose or short-term, 1 to 2 days, if indicated. 7. High-risk patients without surgery, e.g., prolonged immobilization. Indication: preventive anticoagulation in patients with limited mobility due to trauma. Duration: typically 2 to 6 weeks, depending on recovery.